to the third speaker. Our third speaker is Miss Joy Okodute. Miss Joy has a bachelor's degree in psychology from the University of Ibadan. She's an applied behavior analyst technician, and she's also an occupational therapist. She has had over 10 years of experience working with neurodivergent children. Miss Joy will be speaking on at-home behavioral therapy guides, what to watch out for, and how to manage behaviors. Let's welcome Miss Joy. Please.
Good evening, everyone.
Hey, good evening.
Good evening. Thank you so much for having me here. And today I'll be sharing on at-home behavior therapy guide. So, can you help me share my screen, or should I share from here?
You can try. I can share yours. Let me try. Or don't worry, let me just share it. So we have to work now.
Okay, while we're waiting for the slide, okay, like she rightly said, I've been working with children with special needs for the past 10 years, and for me, it has been a journey that I'm loving, and I'm glad that I'm able to touch lives in a very special way. And I really appreciate Mrs. Constilia for the opportunity to come speak to the parents this evening. So, can you all hear me?
Yes.
Okay. So, at home behavioral therapy guide, what to watch out for and how to manage behavior. Next slide, please.
Sorry, I'm coming.
Okay. So behavior is something that any living organism does, and is anything the person actually does, from talking, walking, eating, crying, biting, smiling, blinking. These are all forms of behavior, and behavior don't just happen for no reason. Behavior always happens for a reason, and behavior is also a form of communication, which our children of the spectrum sees as a mode of communication. So when you see them acting up, it's not that they just want to act up, they're acting up for a reason. So we need to understand that behavior is not, we shouldn't see behavior in the negative light. We should also see it in the other side of life, that is the needs that our children engages to communicate with the outside world. Next slide, please. And there are certain things we need to understand about behavior. Behavior happens for a reason. There are triggers to behavior. First is the antecedent. For a behavior to happen, there must be something that have happened for that behavior to occur. And what happens immediately after the behavior is what is called the consequence. I will give an example. You see your child playing with the iPad, and you tell your child, put your iPad away. Then the child starts screaming and shouting, and then you just go and pick the iPad. A behavior has just happened in the ABC order. Your instruction that says put your iPad away is the trigger to the child shouting, and then you're going to pick up that iPad from the child is the reinforcement you have given. That is a negative reinforcement. You have taken the iPad away to prevent that child from using and shouting as a means of getting away from your instruction. And next slide, please. For a behavior to happen, there are functions that the behavior performs. Next slide, please. We are still on this. Yes, there are 4 functions. These are the major functions of behavior. One, no. Go back to the one of functions of behavior. Yes, please. For behavior to happen, is you need to understand: is it that the child is trying to escape a task or trying to avoid the instruction you have given? That is escape. Then the second one is the child engaging in certain behavior to get your attention, or is it that the child is has experiences some level of discomfort and the child is crying to get your attention so that you can attend to him or her? The next reason why behavior happens is tangible. They want something. If they're hungry and they want food, the next thing is to engage in certain behavior to get your attention so that they can have access to food or a toy that they want, or to have access to watch TV, the favorite TV programs that they like to watch. Another thing that happens, that makes behavior to happen, is sensory. This is automatic. Sometimes they are not in control of the sensory issues that occur to them that makes them to engage in certain behavior. For example, a child who is under responsive to sensory stimulation will engage in behavior so as to get sensory input. Like you see a child who is constantly moving, jumping from one chair to another, constantly moving, jumping, shouting. The other child would love to jump on the trampoline so hard because that child is under responsive. So what the child is doing is engaging in things that help the child to seek and get those sensory input. For children who are oversensitive to sensory input, these are children that avoid certain food textures. Some of them they avoid brushing their teeth. Some of them they avoid wearing certain clothes because of the discomfort it comes with. Some of them avoid wearing shoes because the shoes might be too tight, or because of just tighter sensory issues that they are having that makes it so painful. When they put on shoes, they don't feel comfortable. When they wear certain clothes textures, they don't feel comfortable. They want to remove it just to be free. And some of these children, they avoid crowded spaces because of the sensory overload that they get to be exposed to. So these are the major causes of behavior. For some children that are also under responsive, these are children that sometimes they bite, they engage in self-injurious behavior like biting themselves. So these are some of the behavior that major functions of behavior that make children to engage in certain form of behavior. One, I said, for attention, escape, access to something, and sensory. Now, understanding behavior, you need to understand that behavior is a means of communication. You can move to the next slide, please. Behavior is a means of communication. Now, while behavior may be triggered by unmet needs like hunger, fatigue, or discomfort, frustration from inability to communicate their feelings, how they are feeling. So when they are unable to communicate, they will want to engage in certain behavior so as to get attention of an adult to attend to them. Sometimes it could be, yes, sensory overload, loud noise, bright lights, and crowded spaces. Another major cause of behavior trigger is change of routine, sudden change of routine. If they are not, given warnings ahead of time of the possible changes that are going to occur in their routine, this can switch off a child who is on the spectrum off, because they like routine. Some of them, they are so used to their daily routine that if anything changes, it causes a major discomfort and stress for them. So for parents, you need to look out for these kind of changes. If a child who is used to swimming on a Wednesday, and you know that it rained in the morning and that child may not be able to swim in the afternoon, you need to start telling that child right from when the child wakes up, preparing for school. You need to show pictures if need be. Because it rained, there will be no swimming. If you have visual schedules that help to, relate that information to that child, you need to know, deploy, and start telling the child, because it rained today, there will be no swimming. You show pictures and keep on telling. For children who can comprehend verbal instruction, you need to keep redirecting and telling them, because it rained, there will be no swimming, so that you don't cause them some level of stress when it's time for swimming. Another reason is attention seeking, wanting to be interacted with in specific ways. Next slide, please. Hello, are you with me? Next slide, yes. So, common challenging behaviors that we experience in the home environment. One is tantrum. Maybe they want something and you have not been able to provide that thing for them. You see children engaging in intense crying, throwing themselves on the ground. It becomes very discomforting and overwhelming even for the child and the people around. These are certain behavior that occurs in the home environment. Avoiding tasks in the home environment, following routines in the home environment, taking instructions are some of the challenging behaviors that children exhibit in the home environment. Another is aggression, inflicting injury on self, hitting, biting, throwing objects. These are major behavior sometimes that happens in the home environment. I've explained the sensory seeking or avoidant behavior before, and another common challenging behavior is repetitive pattern of behavior, like staying of toys in the home environment and following set schedules and routine, working in certain a pattern and touching different textures in the home environment. Difficulty with transitions, these are common challenges that children experience in the home environment. Next, please. Okay, how do we manage meltdown in the home environment? First of all, you need to stay calm. If a child is having crying and throwing tantrums, you are not to start shouting and yelling on that child, because if you do that, you're just going to be adding fuel to fire. So all the first thing you need to do is you yourself as the adult in the home environment, you need to stay calm. You need to make sure that you're not overreacting. You need to be sure that the environment is safe for the child who is crying. Make sure you clear the room and make sure where the child is crying, especially some children that when they start crying, they don't stay in one place. They start moving from one end to another, trying to look for who to hit while they are crying. So you need to make sure the environment is safe for the child to self-regulate. You need to reduce sensory triggers. If there's a loud noise in the home environment, especially when you're using the blender in the kitchen, that sets children off. The noise alone is overwhelming, and that makes them to engage in certain behavior in the. That can be a major trigger to children in the home. So you need to watch it. Your use of hair dryers, your blenders in the home environment, need to pay attention to it. And also you need to dim your light and make use of weighted jackets if you have at home for a child who is having a meltdown. You need to use visual support to calm that child down. If you have visual schedules that shows picture of somebody calming down, you can use that. And for to teach self-regulation, you need to teach and reinforce coping strategies like breathing or putting hands together or giving yourself a hug and staying still. These are some of the exercises you can do. To have soft toys, good, you can use it for the child. And if you have body massagers, you can use it just to engage the child in self-calming state, so that to reduce the aggressive behavior that the child is exhibiting. Next, please. Yes, managing aggression and self-injury, injurious behavior in the home environment. First of all, before you attend to a child's behavior, you need to know the function that that behavior is serving. Is it that the child is engaging in that aggressive behavior to escape a task? Is it that the child wants something? Is it that the child is trying to seek your attention? Is it that the child is is engaging in an automatic self-stimulatory behavior? You must understand the function that a behavior is performing so that you can know how to address the behavior properly. Now you need to offer alternative method of communication for children who are non-verbal. It is very frustrating that they are trying to communicate. We don't understand, and the only way they can communicate is to engage in certain behavior. If you have a child who is not verbal, you need to employ text, that picture exchange communication system. You need to take pictures of the things that the child likes. the pictures of the food, the snacks, the play, the toys, and the gadgets the child likes to play. We need to have small pictures of it, and then you display it on the table. Once you see the child is about to start, you should be able to identify the triggers of the aggressive behavior, display it on the table, and ask the child, what do you want, and allow the child to point to the picture, the specific one that the child wants. You can use sign language. I know most parents, they don't really like this idea of teaching children sign language, but trust me, it is a means of communication, because most of our communication, actually, they are non-verbal. Your body language is a communication. When you look at a child, and they will understand that this is a communication. When you tell a child come, it is a communication, because there is a gesture attached to it. So for children who are non-verbal, you need to add sign languages to their method of communication, so as to reduce the frustration that comes with not being able to communicate. And for children that are verbal, you need to teach them to or use functional languages to make requests, to express their emotions. You need to teach. And another thing you need to do is reinforce positive behaviors with praises and rewards. You need to make sure that for any attempt, any good attempt the child attempts to perform a positive behavior, don't wait until the behavior is perfect. As long as there is a start, you need to start praising the child and rewarding the child until the child is able to shape that behavior into the appropriate mode that we want the child to get. Redirect safely. Offer a calming activity, like I said, deep pressure hug. If you have body massager, you can use that for children who engages in aggressive behavior. Never reinforce aggression with excessive attention. Like I said in the first one, you must understand the function the behavior is serving, so that you know how to address it. If a child is constantly crying and looking at you, to be sure that you are looking at him, and the cry continues, that is attention seeking behavior. Once the child starts crying and the child is looking for your attention, looking for eye contact from you, you need to make sure know that this is attention seeking behavior. We need to put this behavior into extinction. You need to stop giving the child active eye contact. If a child is always hitting and crying, you need to make sure you remove your eye contact. Passively, you're seeing the child, but you're not maintaining active eye contact, so as to reduce that behavior. And trust me, once you have identified a behavior, and the child, let's say, for example, you take your child to the supermarket and the child sees a toy, and now the child is crying that you want to see a toy, and you always buy anything the child wants, that behavior is going to increase, because the child knows, once I start crying in the supermarket, mommy is going to buy me this particular toy that I need. And for you to stop that behavior, you still need to take that child to the supermarket. And when the child starts asking for a particular thing in the supermarket, you look the child in the eyes and say, no more toys. And then trust me, that cry is going to triple, because you're trying to put that behavior into extinction. The child is going to increase the level of crying and tantruming, calling for attention. You need to stand your ground. The first time you go, no toy, the child will cry, you come back home. Second time you go, the child will cry, you come back home. By the third time, you see that the tantruming and crying for toys in the supermarket will gradually reduce. And that is how you are able to put that attention-seeking behavior, or always wanting to have access to something that the child wants, into extinction. So you need to understand the function of a behavior. Next slide, please. Next slide, please. Now, supportive sensory needs. Like I said, there are children who are under-responsive to sensory stimulus. And for those ones that are under-responsive, they are the one that engages in an intense form of behavior that you will refer, most times they are restless, because they are constantly seeking for sensory input. Those ones, you need to identify that, okay, you need to have a trampoline in the home environment, like swing, supervise to make sure that you are supervising the child, make sure your child is up to 5 years before putting that child on the trampoline for safety reasons. You need to have swing, you need to have body massager, things to help stimulate the child. You need to have bicycle, have somebody training the child. If you have chewables, the plastic that vibrates, you can give the child to chew on. And because the child is seeking for sensory input, you can engage the child in sand play, working with different color, doing palm printing. This also gives the child some form of sensory input. Now, these activities I just mentioned, they are constructive functional activities. But if a child that is under responsive to sensory input is not attended to or given constructive activities to engage in, that child is going to engage in certain behavior that will be so disturbing. The child will be constantly restless, jumping from one chair to another, and you know what they can do, touching the walls and everything. So you need to identify the activities to engage that child in so as to also help in sensory input. For children that are oversensitive to sensory input, you need to understand that some of them may be sensitive to loud noise. You need to get your headphones for the noise cancelling headphones for them. You need to ensure that their clothing are more of cotton and soothing to their skin. Make sure the shoes they are wearing is not tight. Make sure that the brush they're using to brush is sensory friendly. Make sure the sponge you are using to bath them is not hard, because by the time you're using a hard sponge to wash their body when they are having bath, to them that feeling is very painful. Because of that, they will avoid going to the bathroom to carry out any form of grooming. So you need to identify those things. If your child is oversensitive to touch, make sure that you're not taking the child to places where there's excessive touch, so that the child is not getting overwhelmed. So you need to provide, like I've explained all this, create sensory friendly home space, have soft cushion materials and hold that you can place the child to sit on, quiet corners, soft lighting, so that the child is not overstimulated. Now, encourage movement breaks for children who are under responsive. You cannot afford to keep a child to sit down for 1 whole hour without giving break at interval. If it's every 10 minutes for every completed task, make sure that the child goes for a minute or 2 minutes break. And make sure you use reinforcers so that to keep the child motivated while you are engaging the child. You should engage in trampoline, bicycle, and swings, in any sensory activities that the child will benefit from. Make sure you put them into consideration. Next slide, please. Yes, helping with transitions and routine changes. This is another one that children on the spectrum struggle with, that causes behavior. Sudden change in routine dysregulates them. So you need to use visual schedules and timers to prepare for changes. Like the pictures here, if you can have some little pictures of stick them by the wall of the bathroom of the child, and let the child arrange it in the morning. Okay, time to brush the teeth, time to take a bath, time for breakfast, time for this, time for that. Make sure you have pictures representing everything that you're doing with the child. That can help transitioning in the home environment smooth. And when they come back from school, there is still a sticker saying, oh, homework time. After homework time, TV time, after TV time, park time. So that the child knows that, oh, but after each activity, I'm going to the next. But if a child is not on any routine and the child goes to school, the child does not in school, the child is not on any specific schedule, the child is just in the classroom, just going through class routines without even having a meaningful structure that is tailored to that particular child, the child is just going to engage in all sorts of behavior. And when that child gets home and there is no structure in place in the home environment, the child is going to engage in certain behavior, because if you leave them unattended, they are going to find something to attend to. So that is behavior for you. Any behavior that you see at home is as a result of, if they are not attended to, or they try to create one for themselves. So you need to always have a structure that is working for them. Offer countdown warnings before switching to activities. If they are doing their homework, make sure that you're transitioning in a very calming way. Don't There's no sudden change. Don't change. Like when I'm working with children and we are done with one particular task, especially when I'm using object, the hands-on, I count. Oh, it's time to say bye to the numbers. Numbers bye. Number is going. One is going. Two is going. And by the time we put the number, and the child is the one doing the picking. You allow the child to do the picking by themselves. Then the child put the numbers into a ziploc and put it away. And then you are now saying, oh, it's time for letter sound. It's time, and you're bringing the letter sound and giving it to the child to arrange on the table. So that is smooth transition. So know what works for your child, what works for A may not work for B. So you need to know your child and know the level of performance of your child and then plan accordingly. Now, give choices. Now, you can use our social stories to explain upcoming changes. If they're going to have holiday, you need to start telling them, okay, from a Monday, there will be no school. You're going to be at home. This is what you're going to be doing, X, Y, Z. Now, when they are about to resume school back, you don't just wake them up on a Monday morning and tell them they are resuming school today. You need to start telling them a week before resumption, oh, on Monday, you're going to school till when you get to Saturday, Sunday night, you now tell them school is resuming tomorrow morning. So by the time you are waking them up, they are not so off balance because they've been hearing that school is resuming school. So you need to fashion this into dealing with your children in the home environment. Also give choices. Give them opportunities to make choices. Don't make everything readily available for them. And when you give them opportunities to make choices, you're giving them sense of control. And when children are back from school, don't make food waiting for them on the dining table. Let them initiate, whether verbally or non-verbally. Let them initiate so that you are able to give them chance to communicate. But it's when you give them opportunity to make choices that you give them chance to actually communicate with people. If things are already made available for them, they would like, I don't have to communicate with these people in my house. So everything, when I cry, if somebody is bringing food, when I jump up and scream, somebody is turning on the TV for me. So you need to make sure that in your structure, you need to create that space for the child to actually think and do certain things for themselves. Next, please. Now, you need to constantly encourage positive behavior. You need to use clear and simple instructions. Don't start narrating stories in trying to tell a child, sit down or eat your food. Say it straight. Say what you mean and mean what you say to children so as not to confuse them. You reward good behaviors immediately. Don't wait. A child who said hello, mommy, in the morning, you are now waiting till you return from work in the evening before you say, oh, you said hello, good morning to me this morning. Well done. No, as the child is saying hello, mommy, you are saying well done for saying hello. Next time, the child will be motivated to say hello to you. So for any attempt a child made to communicate, engage in a desirable behavior, always reward that child. Have stickers in your house and always pull it out and put it on their forehead. Good job, because you said hello this morning, you're getting the sticker. Because you said you ate your food nicely this morning, you're getting the sticker. Because you play nicely, your hands are quiet, you're getting the sticker. Focus on reinforcing their strengths. Stop punishing their inappropriate behavior. The more you focus on the strength, the more you reinforce the strength, the more you encourage positive behavior, the more negative behavior diminish. So when you start focusing, oh, I told you, stop jumping, stop jumping. This child is going to keep jumping because the child is getting your attention and you keep telling the child, stop jumping. So you say, stop jumping. You're actually, in a way, encouraging the child to start jumping. So when the child starts jumping, just give the direct instruction. John, sit on the chair. Simple. And if John is not sitting, carry John, sit him down. You say, sit down. You just modeled what you want the child to do. So with time, John will understand that when mommy says sit down, even if I don't sit down, mommy is going to make me sit down. Now, let me just sit down. I don't want mommy to come touch me. So these are things that you need to focus on. Be consistent in your expectations and responses. Don't say because you've attended training today, tomorrow you implement it. By next week, the things that you have learned is going into extinction. No, you need to consistent, and you can have to train everybody in your house so that it's not just mommy that is implementing the plan. It's not just when the child goes to school, you expect them to perform magic. You have to do it. Everybody that the child gets across with need to do it with the child so that the child gets to understand that, okay, since I'm getting the same instruction from mommy, I'm getting the same from daddy, I'm getting the same from my aunties, and I'm getting the same in school. Before you know it, you start having a child shaping into what you actually desire. Next, please. So when to seek professional help. If behaviors becomes dangerous to the child or others, you know it's not something you want to manage at home. If a child is crying and the child is always quick to throw something, not minding whatever where that thing is going to hit, or breaking TV in the home environment, smashing your phone, you know you need to have a professional look that child and give you some certain guidelines to know manage that child in the home environment. And you need to, if your child is struggling with severe anxiety or emotional distress, or when you say it's time for school, you see the child is trembling, the child doesn't want to go to school, you need to seek for professional help, understand why, the reason, the function of that child not wanting to go to school. You need to understand the function of the behavior. If progress is slow despite consistent effort, you need to seek for professional support so as to help you. I recently met a parent this week. The child is 11 years old, and the parent was telling me that she has done all she could. Now she's tired, so she stopped doing therapy. I said, no, 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 this child is 11. Very soon, she's going to enter into puberty stage. What are you going to do if we don't plan to prepare this child ahead of time? What if the child starts menstruation? How are you going to cope in the home environment? And you know the child likes to put things in the mouth. How are you going to cope? You can't afford to stop therapy because you have not seen the major progress you're looking for. It's little by little, step by step. So all I can say is, please, parents, be patient and be consistent. You need to celebrate little wins. Don't wait till it's the big one. It's the little one. They say little drops of water makes an ocean. So you need to always celebrate our children. Celebrate them. Don't always look at the things they are not doing now. Focus on the ones they are doing and find a way to make it better. Now seek support network like what you're doing. You're seeking support network right now. Thank you so much to Mrs. Consilia. Now know that you are not alone. Every step you take matters. So do not give up. Do not give up on our special ones. Please, I'm begging. Next, please. So, consistency is more important than perfection. Nobody is perfect. Next slide, please. Thank you. So, any questions?
Thank you very much, Miss John. This was very packed, like seriously packed. I think we can take some questions. Can we take questions like just maybe one or two? Then let's just see. Some people have their hands up. Please, can you take down your hand if it's an old hand, please? Okay. Bukola, please can you speak?
Good evening, everyone. Good evening, Ms. Joy. Thank you so much for the beautiful presentation. Please, I would like to ask, you said there are different reasons for behavioral the trigger. You said to be sensory and some other things. So the question is, how do you, I know you mentioned a few things for you to know that this is what is causing this, but sometimes you are confused. So, for example, my child is on the spectrum, and recently he just start crying. When you ask him what do you want, he will say he wants food, and he's just finished speaking. So you don't know whether it's attention he wants, you don't know whether it's sensory, you're just confused. So in that case, when you don't know what is causing this behavior, what do you do?
Okay, now you said you ask your child will just start crying, and when you ask, the child will say they want food, right?
Yes.
Okay, that is access. The child wants something tangible. The child wants something. That is why the child engaged in the behavior, crying. So it is when you now ask, what do you want? Before the child will tell you hungry. So the function of that behavior is hunger because the child is hungry. That is why the child engaged in crying. So because the child is unable to communicate with words, to come to you that I'm hungry, mommy, the only way that child will actually communicate to you is by engaging in crying. So now you have to work on that crying because each time the child just sees that, because you have reinforced that crying over the time. Because the child knows if I start crying now, mommy will ask me, what do you want? And I will say, I am hungry. And then I will get food in return. So what you need to do is, if you know that, okay, it's almost time for the child to actually have something to eat, and the child starts crying, what you need to do is, instead of asking question, what do you want? And you know that the child wants to eat. What is it? I'm hungry. Mommy, I'm hungry. I want food. You model what the child is supposed to say to you immediately. Don't stop asking questions. What do you want? Because the child knows that you're going to ask, what do you want? Now, if the child starts crying, just model what the child needs to say to you. I'm hungry. Mommy, I'm hungry. I want some food. If you have a specific food that you already have that the child wants to eat, I want apple. I want to eat rice. I want my yogurt. So just model it, and before now asking your question, what do you want? I want food. I'm hungry. So you need to model. It's a way of also training for speech and communication.
Thank you, ma. But I think you missed a part of my question. I said in a case where you know that the child is not hungry, but the child is just saying that I want food, maybe just to say something, maybe because you are asking what do you want. So I feel like maybe the child doesn't even know what he wants.
The child knows what he wants because you can see
It
is
doesn't
it
know.
only
So I think the child knows what he wants, but the child doesn't know how to say it. So the mom has to understand what the child wants and model what the child should say. You have to understand your child very well first. So that in some situations you have to be able to understand what the child needs, and then you have to teach the child how to say what he needs.
yes.
Thank you very much.
Also, I think maybe sorry, because of time, let's move to the next presentation, please. Please, Precious and some other people, please, can you please drop your questions inside the chat area? I'll get all the questions and then I will send to each speaker. I'll get the answers and send to our group, please. Now let's go to the next one. I'm going to stop sharing this one now. Okay, so let's move on. The fourth speaker. Our first speaker is Mrs. Patience Ngamira. She's an early childhood education and nutrition consultant. Mrs. Patience has a bachelor's degree in hotel management, travel and tourism. To support her speech delayed son, she has to take so many courses in early childhood education. She has a diploma in development and education in early childhood, certificate in home education, assessment and methods, certificate in working with students with special educational needs, certificate in introduction to speech therapy, certificate in early childhood holistic education, and so many other certificates, so many other certifications. She is also a homeschool mom and an award-winning public and motivational speaker. Mrs. Patience will be speaking on how to build your child's attention at home during therapy to improve learning. Let's welcome Mrs. Patience, please.
Good evening to everyone joining us across the globe. Happy World Autism Awareness Month, and in this year's commemorations, our theme, as earlier discussed, is Thriving Beyond Autism, and I will be speaking on how to build your child's attention span. So if you can just allow me to share my screen with you. Okay. All right. Can we all see my screen? Okay, so my presentation, just like I said, is on learning attention, building attention span at home. The goals of this presentation is to basically look at what learning at home is. It's also going to look at why learning at home is important, how you can achieve learning at home, attention span, and then I will be taking questions from parents. So basically, learning at home is imparting knowledge to our little ones in academics, life skills, creativity, and personal
Hello, sorry, Mrs. Patience. Your slides are kind of small. We can't see it very well.
Okay.
Are you sharing a PDF version? Do you have the PowerPoint version? Okay, I think it's better.
Can you see it now?
Yeah, it's okay.
All right, thank you. So what I was saying is, you know what they always say, that charity begins at home. What if I also tell you that learning also begins at home? The very moment you get to hold your child in your hands and you teach them how to suck on either the bottle or the book, that's when learning starts, right? So in this presentation, just like the other presenters that talked about in life skills, creativity, personal growth. As a homeschooling mom, I will be taking more on the academics approach, but I'm not going to negate the other life skills, creativity, personal growth. I just want us to focus more on academics as the other points have already been discussed. So now we are going to look at why learning at home is important. I don't know. Okay, here we go. Now we are going to look at why learning at home is important and why it should be encouraged. So first point is creating a continuous flow of learning. So what I'm trying to say is when you create a continuous flow of learning, you are not leaving schools and you're not leaving therapists to do all the work. You as a home support, you are also going to supplement and add on to the 100% learning experience of your child. At school, they learn, but they do not learn 100%. Therapists are also doing their jobs through intervention, but it's not going to be 100%. So what you're going to do as a parent, as an educator, as a guardian, is you are now going to step in and contribute to the overall 100% learning experience of your child. And remember, like I mentioned earlier, I'm not negating other aspects that I've talked about, but I'll just be making emphasis on academics. Number two reason why you should make learning at home a priority is you encourage seamless communication with teachers and therapists. By this, what I'm trying to say is that you know your child better than anyone else. You have first-hand experience. You are the primary caregiver of your child. So of course you're going to know how they do their things. You're going to know their cues. You're going to know how they express themselves. So with teachers in school, it's not really a one-on-one situation. They are carrying everyone along with them. So what happens is the teachers in school might not really give one-on-one attention with maximum effect. So you as a parent, you are now going to have a clearer communication path with the teachers and their therapists and see, look at my child. This is how my child does. This is how my child learns. Then, when you get maybe feedback from your child, you are also going to look at it when you're home. You're also going to look at how your child is adapting to what the teachers are saying or to what their therapists are saying. So that seamless communication, you are carrying everyone along. You are carrying the teachers. You are carrying the therapists. You are not just doing things individually. It's a collective effort. And you know what they say, the more the merrier, the more people involved in teaching your child and also having a clear-cut distinction when it comes to communication is why you should make learning at home a priority. By so doing, teachers, therapists, And you as the parent, you are the middle person there. I know we have parents that have children in school, then they have therapists, then they have shadows. These are three individuals, right? And they might be doing things differently. But you, as the parent, as the primary educator of your child, you are the liaison, you are the one liaising between all the other parties. So at the end of the day, you are at the focal point of your child's learning experience. That's where you can ensure that the rest of the other people are in line. And we are not really messing with the methods, with the ways. We're just creating a very seamless experience for our children. Then this goes on to the learning style as well. Just like I explained earlier, you know your child better, so you know how they learn. You know maybe they are visual learners. You know what makes them want to learn more, and that's the other learning style. A reason why learning at home is important. Then we are also going to look at this point that I said it gives child academic leverage. By this, what I'm saying is, like I explained earlier, in school, a teacher has students, so let's say in a classroom, they have 20 students. A teacher's duty is to carry everyone along. So, for example, this is week 3 in school, right? This is week 3 in school, and our topics for this week are to cover 4 colors, right? We are going to cover 4 colors. That's what we are doing in school. So, what are you going to do at home? When we want to give academic leverage, you bring your child from home, it's a one-on-one interaction. So you will find that a child learns even faster with a one-on-one interaction. Their absorption and their assimilation of information is faster when it's a one-on-one, which is also another reason why learning at home is important. It gives academic leverage. So Monday, remember, colors for week 5 are 4. Monday, you sit your child down, you learn this is red, this is blue. Fine. Tuesday, you do revision of red and blue. You now say this is yellow, this is green. That's Tuesday. Wednesday, you have already covered 4 colors. Wednesday, you are going to say we are going to do revision, right, of the colors. Thursday, you will say, okay, let's learn about orange and gray. Friday, you introduce other 2 colors. And like I need you to pay attention to how I'm saying it, right? 2 colors a day, so that we do not overwhelm the child. So now what happens is that at the end of the week, you have covered 8 colors. Meanwhile, in school, they are covering what? 4 colors. So now you're giving your child academic leverage in the sense that you have worked with your child, not putting pressure on them. Number one, you have taught your child 8 colors. In school, they are learning about 4 colors. Now, what happens in week 6? At school. In week 6, they are now going to cover 4 other colors, and you at home you have already covered that. So now at the end of the day, what's going to happen is when your child goes to school, they are already familiar with the concept of 4 other colors. And now at the end of the day, you see that there is not that pressure anymore for them to catch up because you are giving them that leverage at home. So instead of the school being the place where they are learning new things, a school now becomes a place where they are sort of revising what they already know. This is going to reduce pressure. This is going to reduce overwhelming on the part of the child. And you are also giving them ample time to absorb, to assimilate whatever concept you're trying to teach them. Then the next point is availability of limitless resources. The world is a classroom. In your household, it's an entire classroom. Look around you right now. You might be sitting on a chair. Your chair has colors. You can teach colors, right? Because they become this is red, this is green, or you are in the kitchen. Like the other speakers have said, you need to carry your children along. You need to make to sort of discuss what your child has been doing or describe your day to them. That way, you are in the kitchen. It's a simple exercise. You are making dinner, or you are allowing your child to help you wash dishes, or you're washing dishes. What you can do is a simple plate. What color is this plate? White. That's okay. This is a material. This is different because if you are using porcelain and you are using plastic, if you drop this, it will break. You are teaching cause and effect. You are teaching color. You are teaching textures. Okay, how many spoons did we use today for dinner? You are counting the spoons as you are washing. 8 spoons. Now you've taught the concept of what? Of counting, because the world is a classroom as it is. If you go outside, you are teaching. Make every situation a learning process. And it doesn't necessarily mean that you are doing, oh, sit down, let's copy from the board. Just by communication, that is a learning process that is important. Okay. Um, Learning at home, how? How can we do that? We are going to be narrating your day activities, and that's how you can teach. You can teach everything, like I've just said, educational resources using whatever is at your disposal to learn. You do not need to walk into a shop and say, I want to buy educational resources. Have you exhausted? Of course, they are important. Just like Mrs. Joy has said, you need to think out those things. They are very important, but using the opportunity to teach using the resources around, because you are also teaching them day to day life basics using those things. Up next, we are now going to look at the core of this presentation. What is attention span? Attention span refers to the amount of time an individual can focus on any given task without getting distracted. Everyone has an attention span. I'll give a tangible example. You go to church, there is a preacher in front of you, they are preaching. You go, you sit down, they are teaching what they are preaching on what they are preaching. You are engaged with them. The very moment your brain tells you to say, did I lock my car? Or what am I going to eat? You have been distracted. So the amount of time that you have paid attention to the picture is what an attention span is. So it's the amount of time an individual focuses on a task that is presented to them without getting distracted. Right, and we go on to this table here. It's just to illustrate, right? So on this chart, on this graph, our y-axis.
Sorry, Mrs. Patience. I don't think you are still sharing.
I'm not sharing.
Yeah, well, I haven't been seeing it for some time now. You can continue though. You can continue talking while you try to reshare.
Can you hear me?
Yes.
I'm sorry about that.
Hello. Okay. Yeah.
Are you able to see?
Yeah.
All right. So we are looking at average time span. On our y-axis, we have minutes. Then on our x-axis, we have age. So what I did here is just to show you the average time span according to age group. And from 2 to 3 years old, the average time span is 4 minutes. 4 to 5, average time span is 6 minutes. 6 to 7, average time span is 9 minutes. Um, 8 to ages 8 to 10, average time span is 11 minutes. Then 11 plus, average time span is at 15 minutes. Now you might be wondering, so how do we work with that? The best part about this is time span can be nurtured. You can nurture your little one's time span. And before we get to how you can do that, why attention span development is important. So it allows you learning capacity and information retention is maximized. So the more the attention span is developed, the more your little ones, the more our little ones are able to grasp information at a larger scale. It also reduces frustration between student and educator. I will emphasize on this one. So what happens, let's say child A has an attention span of 5 minutes, right? You as the educator, you will be saying, okay, today's lesson is 10 minutes long. Okay, fine. We are teaching numbers 1 to 10. And remember, your child's attention span is 10 minutes. Numbers 1 to 10, after the fifth minute, your child might not be absorbing as much information as you are imparting, nor would they be giving you attention. Now, let's go the following day. You, as the educator, you're saying, okay, yesterday we did numbers 1 to 10, our lesson was 10 minutes. Okay, fine. Let's do revision for reinforcement to the child. Your child identifies, recognizes, says numbers 1 to 5. But from number 6 to 10, they are having troubles. Now, you as the educator, you might say, oh no, so what's going on? My child is not absorbing information. We did this yesterday, we learned this. Yes, you did, you taught, but was your child paying attention to you? Their attention was not in that exercise as you might think it was. So what happens now is you might get upset, then you might start yelling. Now this is the domino effect. Like what Mrs. Joy has already said, you do not need to yell, you do not need to pound. You do not need to yell, shout, or beat. So what happens now is that you get upset. What is going on in a little one's brain is that, okay, so when it comes to learning, then I'm going to be like, they are now attaching the process of learning whilst sitting to something like mommy will beat me, daddy will beat me, my sister will get upset, they will yell, they will be upset with me. So now you are inducing fear so much that when they see you carrying books, maybe to do homework, they'll be like, oh no, here we go again. What is going on? I'm about to be yelled at. So to reduce frustration, you need to acknowledge time span, attention span. Then it helps in social skills and ability to understand social cues. It helps with participating during therapies. It also enhances cognitive development. So the bigger the attention span is developed, the more it's going to make learning a much bigger experience. It's also going to make learning what do you call, it's also going to make learning a more fruitful exercise. Now, let's look at the factors that affect attention span. We are looking at environment, we are looking at interest, nutrition, workload, physical well being, educators' method of teaching, and screen time. So our first point is environment, factors and practical measures, so that we just deal with one factor and the practical measures that we can employ. Environment, we are looking at the place that your child is learning. If it's in academics, remember, we are more like in the academics part. Noisy place, distraction, those are factors that might affect attention span. The measures, remove any distractions or toys that you are not using to teach that concept. That helps in, if you put a child's favorite toy and you're trying to teach them that has nothing to do with that favorite toy, their attention is going to go to what? To that toy, and they might not give you 100% attention. Then switch off TV, switch off music, you find a quiet place, sit child in a chair or table, and for the younger children, sit them in a high chair. The reason why we are doing this sitting in a chair and the table is you are minimizing movement, right? So you are minimizing movement because if you remember, okay, let me just give this disclaimer. This is us trying to build our children's attention span. These are the initial stages. And as children develop their attention span, as children develop attention span, you might be removing these, right? So sit child in a chair or table or a high chair. This way, you are restricting movements to 180 degrees, straight line. They can see like 180 degrees. If you make them sit in a place where they can move around, then they're going to give you their back, and that does not really help in improving attention span. And you, as the educator, sit at eye level. The reason why you're sitting at eye level now is that psychologically, using eyes can hold and attract attention. You seem to be holding attention more when eye level is involved. Now, for our children who might not necessarily um, hold eye attention, what you're going to do is the use of voice. They might not really be looking you in the eyes, but they will be following where the voice is coming from. So that makes them really look at where you are or within the vicinity that you will be sitting. Another thing is the reason why you're sitting at eye level, you are de-rolling. Okay, by de-rolling, you are a mother throughout the day, you are a father throughout the day. So when you sit down, you have that sense of authority. So when you sit down, you are sort of de-rolling and putting yourself at a place where you are the educator. Now you are seated down, you are holding eye level. There is a sense of equality, right? That aspect of authority that might be imposed might not necessarily be there. So you realize that you are going to be to hold more attention from the child. And another thing is if you teach while standing, your child has to look up to find your eyes or your voice. Now, if you are standing, you are taller than them, they are going to be in a posture where they are looking up to you. That posture will make them physically tired, so you will not have their attention for long. So this is on environment. Now, interest. I'm really glad Dr. Grace touched on this earlier. Observe what child loves and use it to teach. Having their favorite characters around them who have them engage with you for longer periods of time. So what we are now doing in this aspect is, sorry, for lack of a better word, is manipulating what they love. Dr. Grace said your child might love cars, your child might love dinosaurs, your child might love pills. Perfect. Take your cars, teach concepts that have to do with cars. I'll look at numbers. Take masking tape. You know that tape, masking tape that you have around your house, that even if you gum it on a surface, it does not leave residue. That's perfect because you are also going to not wear out the toys so the toys remain clean as possible. Take that masking tape, take your child's card, teach what you want to teach, write with a marker A, use your card to say this is A, this is B. Okay, baby, now move your car A and move your car with big A, perfect with your car with small A. Take masking tape, put it on your dinosaurs, teach letter sounds. Take your masking tape, put it on bricks, teach how to spell their name. Fine. Okay, they like Spider-Man. How do you incorporate Spider-Man in learning? There are a lot of worksheets that you can personalize and customize so that they learn how to count how many Spider-Mans are there. How many Spider-Men, sorry, are there. They can learn to count how many words are there. They can learn to count, oh, this word has letter A that says ah. Okay, this word is green, this word is blue. Okay, this word sequencing is blue, red, blue, red. So what other word is coming there? Then they get to teach that. So this is on interest. The next aspect is nutrition, just like what Dr. Ipi talked about in greater strength. Let's reduce sugary foods, let's reduce processed foods. And she also talked about gut brain. On recommendations, I've put fish, omega-3 fatty acids, avocados, eggs, nuts, lentils, and gut cleansing meals.
Hello.
And at the end of the day,
Hello, sorry to interrupt. Sorry, please let's try to hasten up. Doctor, if Mrs. Iffy has a meeting, some people need to. Okay, thanks.
Okay, I'm almost done. Thank you. Thank you. That continues, and that's what on factors and practical measures. Then workload. physical well-being, we are looking at the workload and physical well-being of the child, right? So school schedule, long hours, extracurricular activities. This impacts on how much attention your child is going to give you. This so maybe they had sporting day in school. You can't expect them to come and sit for longer hours because they are tired. We are also looking at measures like, excuse me, like plan lessons accordingly, allow breaks in between, allow enough rest before lesson, and plan lessons to avoid cluttering that will result in being overwhelmed. Then educator style and factor is a factor in the practical measures. Observe child learning style, remove distractions, be consistent, do not yell, shout, or beat. Observe both verbal and nonverbal communication. Observe child's cues, plan and set clear goals. And as educators, parents, sisters, uncles, aunties, godparents, give yourself grace and give yourself a lot of it. And yeah, this is the questions on attention span, but because of time, please leave them in the chat box. And thank you so much. This is how you can reach out. And I'm a bona fide member of Miss Concilia Njoku's home speech therapy coaching group. So if you have any questions to those that are not in the group, then maybe leave them here. To those in the group, then you can